For some reason and all that mix up here, I may have to just ask you a couple questions real quick, follow
Sure.
up. So, first and foremost, thank you for taking a minute out. I want to begin with COVID. How much of living through that has still affected your work and what you do now?
COVID is still affecting what we do now in medicine. We've not recovered. I think a lot of people would like to think that it's gone away, but the damage is going to take a generation to resolve. Um, there was an abrupt, after the pandemic, there was an abrupt 20% decrease in the workforce, the healthcare workforce, doctors, nursing assistants, respiratory technicians, and my personal belief is that it's due to post-traumatic stress disorder. Um, the PTSD is a real thing in medicine. I talk about that in my book. When I was recovering, uh, I kept waking up in rehab as an inpatient, physical therapy, getting physical therapy at Spalding Rehab Hospital. I kept waking up with nightmares that I couldn't breathe, and they were debilitating and relentless. Nothing seemed to help them. And one day, a physician came in and he talked to me for a long time, and he basically said, "I think you're demonstrating signs of post-traumatic stress disorder." As a physician, I understood post-traumatic stress disorder as something that happens to combat veterans and to victims of violence, but it wasn't really well known then, and even really not well known now, that post-traumatic stress disorder, it can also be a consequence of medical trauma. And I think there are quite a number of people who still are suffering the effects of that. We saw a rather marked increase in alcoholism and drug overdoses during the pandemic. Red flag warnings of um, poor adaptation to PTSD. There's a generation of children that lost out on the important socialization that they get in school.
Yeah.
And it's not trivial. And those kids are still struggling. My son is a teacher, and it's not talked about, but it's out there. And all the hospital emergency rooms are deluged with patients right now. There's rampant overcrowding in the emergency rooms, and much of it's driven by psychiatric related illnesses, particularly in children. Most all the big hospitals now have a waiting list of children boarding in the emergency room, waiting for inpatient psychiatric beds. It's going to take a long time for the country to get over the effects of COVID. Um, we're still short quite a number of healthcare providers, both in mental health providers as well as nurses, physicians, nursing aides. Hospitals are sort of stuck there. They have patients that can be discharged, but they need to go to nursing homes. But the nursing homes have many closed beds because they lost a lot of their staff.
Yeah.
And unfortunately, a lot of the staffing is from immigrants, and that's a challenge right now. And it's it's going to take a generation to fully recover from COVID.
Yeah. So talk to me a little bit about when you were young, when you were in grade school. Did you always dream of getting into medicine?
Not always. Um, my mother was diagnosed with breast cancer when I was in the fourth grade, and cancer was a word I'd never heard of. I didn't know what it meant. Um, I learned firsthand what cancer meant and about suffering. And she had one breast removed. This was in the 60s. Cancer care was fairly primitive. Um, Halstead procedure was a radical mastectomy. The breast was removed, all the tissue right down to the muscle on the ribs was removed, and all the lymph nodes in the arm were removed. So your arm swelled up like a sausage, and it was horrible surgery. She had a recurrence several years later in the other breast, and when I was in the eighth grade, she died when I was 13 years old, and that was my first introduction really to healthcare, and it was pretty traumatic. It took me a long time to process, but I realized that helping people was something that I wanted to do, and that there were a lot of things that I saw that I thought could have been done better. And so I decided at that point to think about a career in medicine.
And
I stayed with it and I finally did.
yeah, so you said your dad has been your hero and your inspiration.
Yes. Obviously, it was a painful thing for him to go through, and it nearly broke him. Um, and his friends were telling him to put us into foster care. He said, "No, I can't do that. Their mother would hate me forever." So he took care of us and he basically sacrificed his life to keep the four of us together as a family unit. And it's resulted in a very unusual closeness with with my siblings. And a lot of families drift apart. My siblings and I remained exceptionally close. And it was that the courage and the faith and the determination to keep us together as a family and the love, the unconditional love that he showed that helped form me as a person, helped me to be a better person, a better father. Just, it was taught me a lot of lessons.
So you've had quite an interesting life. The subject of your 2024 book, Physician Heal Thyself, is about a near-death experience. Talk about this book.
So I was 61. I was at the peak of my career. Um, I had really hit every metric that you could possibly make. I mean, I was 8 times listed as a top cardiologist in Boston Magazine, as a chief medical officer for my group. And I had started out with a cold in the middle of December of 2013. By December 31st, my breathing fell off a cliff. I woke unable to breathe. My cold had developed into pneumonia, and then I was treated with antibiotics, but I failed to respond. And 911 was called. I was brought to the hospital I worked at for nearly 30 years. In the emergency room, it was obvious I was in severe respiratory distress. My chest X-ray showed that both my lungs were completely whited out. Normally, the lungs on an X-ray look black to reflect air. Solid things like bone come up as white. Pneumonia comes up as white. The pneumonia had really now involved all the lobes of both of my lungs, a condition called acute respiratory distress disorder. Um, it's syndrome, acute respiratory distress syndrome. Um, Very high mortality. I was put on oxygen in the emergency room. It failed to really respond to that. And I was intubated electively in the intensive care unit. And For 11 days, I was on life support, near death. I actually had a near-death experience where I could feel myself just floating away. And then I heard a voice, a vision, this white light telling me it's not my time, you must go back. And then next thing I remembered, was hearing my wife speak into my left ear that things were getting better. And it was very strange. I didn't know whether I hallucinated that, but it was just an odd coincidence. I can't explain it medically,
Yeah.
but it happened. Um, and when I've researched a lot of near-death experiences, there's similarities in that. Um, After 11 days, I came off the ventilator and I started with physical therapy. And they realized pretty quickly that I was paralyzed from the neck down. I couldn't use my arms or my legs. I couldn't swallow, aspirated anything put in my mouth. And there was a lot of discussion as to whether I had critical care myopathy, an adverse reaction to the paralytic agent I was given on the ventilator, Norcurium, or Guillain-Barré syndrome. After some testing, it was determined that I had Guillain-Barré syndrome. It was a pretty terrifying experience, and it totally blew up my world. Um, from there, I went to Spalding Rehabilitation Hospital. I spent 6 weeks learning how to feed myself, to walk, to dress. I was still short of breath. My lungs were still recovering, and I realized that my life, as I knew it, had abruptly changed, and it was unclear how much of my life I was ever going to get back. And I realized that if I gave into that thinking, perseverating on what I had lost and could never retrieve, I would spiral into a dark hole. Um, so I began to just focus on what was in my control, working with the physical therapist, trying to get stronger every day. I realized that I needed metrics to show myself that I was prove to myself that I was getting better. And sometimes those metrics were as simple as just being able to take one additional step a day
Yeah.
to be able to like cut my food to feed myself. And I just used those small building blocks as a way to measure my progress. And I just focused on what was in my control, which wasn't very much actually. I needed a lot of care. And little by little, over the 6 weeks, I began to show improvement. I was very weak, but I was able to get some movement back in my hands, my legs. My first real sign of improvement was when I could swallow without having it go down the wrong pipe and choke. Being able to eat solid food was my really first really big step forward. Um, After about 3 weeks, they got me up in a wheelchair. I went to the gym and they had me try to do some very, very, very basic exercises, and they were exhausting. I resisted the urge to quit. I just said, I have to do this. I remember things my father told me. My father had emigrated to the United States from Ireland. He came over in 1929 when he was 17. He'd only had a sixth grade education. And I asked him, why did you pick such a terrible time to come to the United States? He said, as bad as things were in the United States, they were worse in Ireland. And that if you're willing to work hard, you could get by. If you had, if you got knocked down, pick yourself up. The most important thing in life to remember is never quit. And I just kept telling myself over and over again, do not quit. Find a way, just get up and put one foot in front of the other. And I just kept telling myself that every day. And little by little, I gained strength. It was hard to measure day to day. So week to week, you could see some progress. Um, I was there for about 6 weeks. At about 4 weeks, they gave me a day pass, and my wife took me out in a wheelchair to a nearby restaurant. It was a beautiful day, spring, sun was shining. It was glorious. It felt normal. I convinced myself I was better. I'd be going home by that weekend. The weekend came and went, and I wasn't discharged. I really wasn't strong enough. And it was then that I fell victim to the Stockdale paradox, which is what Admiral Stockdale described in his book relating his 6 years of captivity in the Viet Cong. And he talked about the fact that the people, the soldiers that survived, never lost sight of the fact that somehow, someday, they would make it home. But those people who locked in a day, whether it was Christmas, Thanksgiving, the 4th of July, that they would get home, and the day came and went, and they didn't go home. They lost hope, and they withered away and died. Viktor Frankl, in his book Man's Search for Meaning, when he described his time in Auschwitz, said the same thing, that the people who locked into a date when they were going to get out, and the day came and went, they lost hope and died. The people that looked at the past and what they had lost died. The people that focused on the horror of their day-to-day existence died. So it was the people that were able to look to the future and have some hope for a future, even if it was different than the one they knew. Those were the ones that survived. And his major lesson was that bad things can happen to you, but it's up to you individually how you react to those things. The thought process goes back to the teachings of Epictetus, an ancient Greek scholar who said the same thing. It's up to each individual how they respond to the difficulties that life puts in the way. You have to have hope for the future. So I just focused with all my renewed passion, looking to the future, knowing someday I would find a way to overcome. Someday I would find a way back to a life with meaning and purpose and happiness. And I learned it was a year and 10 months before I was able to return to work. But it wasn't what I did before. I was unable to work in the hospital or care for patients in the ER or the ICUs. I was confined to the office. Walking was difficult, breathing was difficult. Um, but I did get back to work and I did find happiness again. I realized it was a long time before I could feel happy, but I realized that happiness really is something that comes from within. Comparison to what you had in the past for what you may never have had, or comparing yourself to what other people had, will never make you happy. You'll be sad and resentful. You have to be happy with what you have. And I was. I had a loving wife, children, friends, and I was working. It gave me meaning, purpose, and the happiness I realized came from within.
Yeah.
It took a long
So,
time.
yeah. I'm sorry, I didn't mean to interrupt. I was just go ahead.
It's okay. It took a long time, a year and 10 months from when I got ill to when I got back to work. My life was not the same. It was different, but it had meaning and purpose, and I found happiness.
Yeah. So you've given a wonderful abstract to the book. If anyone wants to go out and get a copy, they want to dig into your story more, where's the best place for them to pick it up?
Probably the easiest place is Amazon.
Okay.
It's called Physician Heal Thyself, Nearly Dead, and the Journey Back to Health.
Absolutely.
It's it's not I purposely made it not a long book. I tried to distill the lessons that I learned and the lessons that I gleaned from reading other stories of people who survived horrible life events and found a way back. And I think the message for your listeners and for anyone who reads the book, I go through what worked for me, and I think they're universal lessons. And I cite the literature that I read and found helpful. And I put in quotes from there and describe how it is possible in the face of just unthinkable tragedy, personal tragedy, that you can rebuild. It may not be the same life you had, but it is possible to rebuild, to find meaning and purpose and happiness.
It's a wonderful story. Thank you so much. Thank you for taking a minute out to kind of give us an abstract. I will put all of it in the show notes to Amazon. And best of luck. What an incredible story. I appreciate your time today.
Thank you very much, Joe.
Thank you, sir. Take care.
Have a good day. Bye now.
You too. Bye bye.